Good morning, good afternoon, or good evening, wherever you are on the planet this morning, for me at least. Welcome to the webinar. This is a Euro-Mediterranean Economists Association webinar in partnership with the Global Brain Economy Initiative. This webinar is held in the context of the World Economic Forum's Brain Economy Action Forum, of which Grand Challenges Canada, the Davos Alzheimer's Collaborative, IHME, and EMEA are members. This webinar is also being held now in the context of the Nature Medicine Commission on the Brain Economy, which is a new project that we are just undertaking where a number of our speakers today are also on that commission. That's a science commission to reinforce and advance the science of the brain economy. Today, we're here to talk about the African brain economy strategy. This is a strategy that has been emerging over the last couple of years in various different manifestations. And today, we want to update the strategy and bring together the threads of science, data, finance, and policy. Previously, we've been working in Africa around the Yaoundé Declaration, for example, in Cameroon. Great work led by Alfred Namshi. There's also a major convening last year on the sidelines of the G20 in Johannesburg, led by the Davos Alzheimer's Collaborative, with most of our speakers being there. But let's update this work. We now have in 2026, the new World Economic Forum McKinsey Health Institute Brain Economy Report, the Brain Capital Index, and a bunch of new work around science and financing as well. So perhaps without further ado, let's get into the meat of this webinar. I want to invite Rim Ayadi to speak first. Rim's the founder and president of EMEA. And Rim is going to speak to new data from the Brain Capital Index. So this is being unveiled today and will be a great way to start the conversation from a data-driven perspective. So Rim, thank you.
Thank you very much, Harris. So I would like to ask, yes, my slides are here. So first of all, it's my pleasure to be with you today to discuss this very important topic, which I believe will shape the future prosperity for Africa based on brain capital. So what I want to present for the next 10 minutes is our work based on the Global Brain Capital Index on particularly Africa brain economy and brain capital trajectory, and also the process for transition that we have provided some recommendations for going forward. So let me start with the first slide. So just to refresh what we talk about, in fact, brain capital is a framework that combines 3 dimensions: brain health, brain skills, and the enabling systems that allow people to flourish. And these enabling systems include practically the education systems, the healthcare system, digital infrastructure, institutions, innovation ecosystems, also the environmental setting, means climate and level of pollution, and also social protection. So our brain capital framework, dashboard, and index help us really to measure how countries develop, protect cognitive and human potential. So our central hypothesis here is pretty clear. Future prosperity increasingly depend on society ability to invest in brain. And this is the main hypothesis on which we developed our work. Next slide, please. So, in fact, as an economist, I can say that brain capital index and framework represent an important shift from the traditional metrics, framework and metrics on human capital. So, in fact, historically, development models focused mainly on labor, on product and productivity. But today, economies must also develop other dimensions, which we didn't take into consideration in the traditional modeling, mainly creativity, adaptability, emotional resilience, cognitive performance, innovation capacity, and brain health as a core dimension that we are centering our thinking about. Now, the index therefore integrates, as I mentioned, brain health. This is the central pillar, brain skills and the enabling environments, which we constructed three sub-indexes that you can see in front. And then the core index, in which we try to understand the capacity of brain capital for each country, is the brain capital index, as you see, brain health, the combination of brain health and brain skills. Next slide. So, in fact, our hypothesis is to say that we are trying really to move beyond, but then also build on the human capital framework, which has served our economic modeling for years. Next slide. So, as you can see here, this is our first slide on the data that we have collected over the years from 1990 to 2025. And clearly, we examine the trajectory, which in fact, we observe as gradual, but also very meaningful progress for Africa. So in reality, you can see a trend. I mean, of course, the line that you see on the above, this is high income countries, but all the below, you can see Africa, and there is a huge potential for catching up. But then clearly, the catching up is happening. Now, next slide. So the composite index has increased slowly over the time. Why? Because of the educational participation, expansion, digital connectivity, growth, and also the entrepreneurial ecosystems that have emerged across the African countries. This will tell us very importantly, Africa is not stagnant. Africa is progressively building the foundations for a future brain economy. However, this transformation remains uneven and fragile. Of course, we need much more investment. Even if countries are progressing, they face still structural vulnerabilities, institutional fragilities, and high exposures to geopolitical and economic shocks, and also, very importantly, conflicts. Also, the regional divergence remain extremely significant. Of course, we built the regions, as you can see it here, but one really needs to assess this transformation based on the non-linearity of the continent. So, in fact, if we don't do this, progress may exist, but resilience remain largely incomplete. So next slide, please. One of the most encouraging finding in this work, and of course we keep it, I would say, I always want to be careful because of the data availabilities here. We can have much more data on this pillar, but clearly it's very encouraging to see that whatever we assessed within the Brain Skills Index, the evolution, it's rather encouraging. Across the continent, brain skills are improving faster than any other brain capital dimension. And this progress is driven by mainly the digital learning ecosystems, mobile internet penetration, youth entrepreneurship, growth in education and skilling, and also the rapid growth of fintech and digital ecosystem. So also Africa youth is increasingly connected, adaptive, and entrepreneurial. And this cognitive dynamism represents one of the key long-term assets that needs to be really invested on over time. Next slide, please. At the same time, again, we need to be careful with the data availability and also how to assess brain health. Brain health remains Africa's greatest structural vulnerability. And brain health is no longer, in fact, a health issue, as we discussed this several times in our discussions. It's an economic infrastructure, and it must be looked at as such. Many countries in Africa face enormous pressures, weak, for example, mental health systems. It's very clear that's generalized. So we can do much more in Africa in terms of data on brain health and mental health. Also, conflict-related traumas. We need to build this. We need to understand a little bit which are the countries that suffer from conflict and the impact of those traumas. Urban stress, of course, because some cities are super urbanized, other not. Also the substance use, this is another element that one needs to look at, and obviously the shortages of mental health professionals and still malnutrition that Africa suffered from. So the consequences are economics as much as social, and then in fact they impact productivity, innovation, and also greater social fragmentation and weaker resilience thereby. So without healthy brains, in fact, no society can fully unlock its developmental potential. Next slide, please. So this leads us also to the core structural change. The problem is not the lack of human potential. The problem is insufficient enabling systems and enabling environment. So more investment has to be put there. In many countries, cognitive aspirations and skills are rising faster than institutional capacity. And this institutional capacity is dragging, in a way, the capacity of a country to enhance its brain capital. And we continue to observe major gaps in this institutional quality. We've seen it before. Healthcare system, there is a huge potential there, and also the generalization of digitalization within the healthcare system, also educational quality and innovation ecosystem that can be enhanced over time. So unless enabling systems improve, Africa, in fact, risks to create a mismatch between rising aspirations and limited opportunities. Next slide. So I wanted to focus on the digital transformation as a brain capital accelerator, and I think this is also interesting to look at. One of the stronger accelerators is of the brain capital accumulation is this digital transformation. But then, of course, one needs to manage it very carefully. Of course, we can observe remarkable innovation, for example, in mobile connectivity, fintech systems, online learning, artificial intelligence ecosystems as well, and digital entrepreneurship. I mean, we can see based on the different regions like East Africa and West Africa are emerging as particularly dynamic regions. But then the digital transformation allows Africa to leapfrog traditional development constraints and expand access to education, healthcare, finance, and innovation. And technology, therefore, can accelerate the brain capital accumulation at a huge scale. And this is an assumption that we make, but we need to test over time. Now, the second point I want to focus on is this demographic dividend. Next slide. Of course, Africa has the youngest population in the world, and this creates extraordinary opportunities in terms of expansion of labor force, innovation potential, and future productivity gains. But demography alone is not enough. A demographic dividend can become a curse if it's not very well invested on, without really a huge mobilization of investment in brain capital. Demography becomes really a curse in terms, for example, of youth unemployment, learning poverty, cognitive stress, and social instability. And I want to also show you next slide, which is the regional divergence across Africa. Of course, I don't have the time to dive into each of the specificities, but overall, it's clear to me that Africa does not follow a single brain capital pathway. So we need to have differentiated pathways by regions and also by countries. For example, Eastern Africa is emerging as dynamic brain capital frontier, but we need to dig further into why and how to move certain countries into the framework of brain positive countries. So South Africa has stronger foundations, but faces mounting pressures, and we need to understand those pressures, and so on. And these are all elements that one needs to be looked at extremely carefully. I will go faster here because maybe we need to do another webinar, Harris, on brain capital and growth. Next slide. But clearly here, this GDP per capita continued to rise in many countries, as you can see, but then brain capital gain slowed and weakened after 2012, and this suggests that economic growth is not sufficient. Growth without sustained brain capital investment creates fragile development model. We are working on a paper particularly on this to better dig into the causality, but clearly this could be a very interesting, I would say, hypothesis to test on GDP. It's not enough. It needs to be complemented with other metrics that are human-led and human-based to assess human well-being. And then this result, it's clearly shown in the next slide on brain health, also with economic growth. And it's clearly showing a decoupling since 2010, which allows us to say that, again, growth does not guarantee us a sustainable prosperity. And in fact, true economic resilience requires investment in, as I said, mental well-being, quality education, social cohesion, and other very strong institutions. So next slide, and I'll leave you to see here the strategic policy priorities. Clearly, there are strategic policy priorities. Now, we've been all discussing this. Strengthening the brain health systems, investing in early childhood development, building brain positive education systems, expanding digital cognitive infrastructure and supporting innovation ecosystem, plus reinforcing the institutions and the social protection within these countries. And in reality, these investments are not social costs, they are economic investments, and they are strategic for the future of Africa. So my next slide, and I will let you read it, the last slide. In fact, Africa has the world's greatest future brain capital opportunities. It has all what I have said before, and all of you know this, but to realize the full potential, one needs to invest. And this is why the work we do on investment on brain capital is super important to ensure that if Africa would succeed to build a brain positive economy, and it can become one of the major drivers for global development and sustainability. Thank you.
Thank you, Rim, for thanks so much, Rim, for kicking us off. I think that's a treasure trove of new data and new insights, and the perfect way to get this started. And many thoughts to share, but let's hold the discussion for later on. Next, I would like to invite up Kirsty Donald, who's the Deputy Director of the Neuroscience Institute at University of Cape Town. Kirsty will be complementing that first presentation with a scientific perspective on African brain economy. Kirsty, the floor is yours.
Thank you for that kind introduction. Let me just share this. Right. So, I've been asked to give you a little bit of an outline of how we are starting to assess that scale, some of the kind of more scalable metrics, and with a focus on early life, which is my area of work. So thank you for this invitation. As you've already heard, Africa has a young population, and this will continue to be the case for some time. Of Africa's projected 2.9 billion population in 2050, 1 billion will be children, i.e. 35%. And by the end of the century, half the world's children will have been born in Africa. So it's really important that we get this right, not only for the potential of our current children, but for the future of the world's children and population. We are also disproportionately burdened with risks to brain health. And you've heard a little bit about the vulnerabilities towards that. But there are many risks that are potentially preventable and environmental vulnerabilities that are potentially preventable. And there are potential interventions that could make a difference on these, but we don't have good ways of measuring this in early life. And early life is the platform of which it's not your early brain health is not necessarily a destiny for your later brain health, but it's a really, really important platform of which your brain health potential develops. You've heard a little bit about the increase in digital coverage, but it remains patchy. And not only does this mean access to, and this sort of NASA picture of the world electrification is really just a metaphor for services, education systems. And we are still moving into a space where this is more evenly distributed. So while we have these things, they are still very patchily available across the continent with a bigger, with, as in most places, more access in the cities and some areas of very poor access in the interior and in the rural areas. So moving quickly on to how can we measure very young brains at scale? So we can measure behavior and development. We can ask questions and we can do structured tasks. But those of you who've had access to, who spent time with little children know that if they're hungry or tired, they're not going to engage with your tasks. They're not going to do what you want them to do in the moment. And that doesn't mean that they have a developmental delay. It just means that they're not in the mood that day. And so is there a way, if we're looking for ways to understand how some of these risks impact on brain development, and we're also trying to understand how to measure outcomes if we're going to do interventions in very early life and in pregnancy, where before all the kind of intercurrent things start interfering with the story, we may need to do things in a more precise way and in a more brain-focused way. Typically, we've used stunting as a proxy for this, but stunting is not brain. And fixing stunting, although it's obviously good for the child and it is good for your development, it's not, oops, sorry. It's not the same as actually being able to measure the systems where you're interfering, where you have an intervention. So let me just, oh my goodness, now the slides aren't working. So other ways that we can measure brains more directly includes MRI, but MRI is even more scarce than that picture that you saw on the electrification. Increasingly recently, though, there's been a big move with improvements in technology to develop scalable tools. And on the right here, you can see a small mobile MRI scanner, which is built with a permanent magnet. So you can drive it down the corridor, doesn't need a shielded room, and takes as much electricity as a toaster. So it's a lot more accessible in terms of being able to scan larger populations. Increasingly large, there's been large investment into the rollout of many of these systems in the research context across Africa and Southeast Asia. And so there's the potential for large multi-site, multi-scale studies to try and understand what's putting children's brains at risk and what kind of interventions are going to make a difference. There are other open source systems which actually, where the blueprints are out on the internet and where you can 3D print the components and build the scanner yourself out there, which are gaining traction. So it's not just commercial systems, it's also this move towards open science, improving skills in being able to build these things yourself and be able to maintain and optimize sequences and optimize approaches for the populations who are in your particular environment and the conditions that put them most at risk. We've been in a unique position to do some validation studies because we have a high field research scanner and we have one of these low field portable scanners. And we've showed working with partners in at King's College and other centers across the world have worked to develop not only acquire scans well, but to be able to improve the resolution and be able to improve the processing and segmentation techniques so that we're able to get reliable output from even very, very young infants, which is traditionally hard, even at high field. Here we've been able to answer questions which we think are important in our region. So this is one of my PhD students, Jessica Ringshaw. On the left, you can see she looked at high field to see if there were differences in brain regions associated with antenatal anemia and iron deficiency. And on the right, in the same children on the low field scan, we're able to replicate those results exactly. We can also use EEG. It is a very replicable and reliable method that can be used and cheaper even than portable MRI and much more functionally sensitive. So this is the visual evoked response and which develops very rapidly in the first few weeks and months of life. Your response becomes faster, becomes tighter, and we can map this over time in a very predictable way, and even develop growth curves for children just based on the different metrics extracted from the visual evoked response. This is just one example, and there are others. So scalable EEG systems can allow for rapid, easy brain measurement, even in these first weeks and months of life. And a delayed maturation of VP correlates with less myelination on the scan at the same age. So we know it's related to the actual physical brain development as well. The signals are sensitive to early developmental differences. So those changes where you fall on those growth charts actually correlates with your developmental outcomes at later ages when those behavioral assessments are more stable. So we can do growth charts and predict very, very early metrics of later outcomes, which are important. And they've been validated across different populations, both ours in South Africa, as well as Brazil and America. And here's the rub. This is a new, even more scalable system, which we're starting to test now against the higher field EEG. So both scalable structural assessments and functional assessments are absolutely feasible in these environments. It's not just about the stuff, it's also about the people. And we've become a hub of training, working with King's College and some of the kind of hardware specialists to be able to roll out training not only in MRI acquisition, but also in processing and use of these data to be able to answer important questions about young children's developing brains. It's the hardest period to study, but critically important. Again, it's also about scientific leadership, and this is a network across the region with funded fellows working on masters, PhDs, and postdoctoral projects related to brain health and development. So in summary then, brain development is complex and iterative, but incredibly important. MRI and EEG work in these populations and in these environments are feasible, scalable, and increasingly affordable. So I think that we really need to be thinking about what are the tools that we're using so that when we make these changes, when we start really making the big policy pushes around public health, that we're able to evaluate what we're doing. Because, we've known stuff like that iron deficiency is bad for children for decades, and we are not yet getting it right. In fact, we've gone backwards in certain parts of the world, despite policies that make iron supplementation routine practice in pregnancy. So we need to understand this nuance, and we need to be pushing forward for better solutions. Thank you. Thank you to my team and to all the collaborations. And I'll stop there.
Terrific. Thank you, Kirsty, for that wonderful overview of those innovations and the rallying call for the importance of science. We also, Kirsty may have frozen. We also recognize, Kirsty, that maybe we can unpack this in the discussion, the leadership role that you've played in capacity building for neuroscience across Africa. So as Rim alluded to in our opening remarks, the institutional capacity and enabling infrastructure is key to the African brain economy transition, and I think science is absolutely vital there. And you've laid out a vision for how to do that and what is being done already. So thank you for adding that to the discussion this morning. Now I would like to invite Angela Apagai. I hope I got the pronunciation correct, Angela. Normally I just call you Angela. Angela's from the Institute for Health Metrics and Evaluation. She's a professor there. And I'd like to hand the floor to you, Angela, now to share with us some of your latest work, particularly around modeling of brain economy interventions. Over to you.
Excellent. Can you see the slide?
We have them up, yes.
Okay. Thank you, Harris. Quick point of correction. I'm an assistant professor at IHME, working up to the professor status. So
we gave you a promotion already. So
but today I'm going to talk about predictive modeling for brain capital in Africa, focusing on some of the work that we have done there. To begin, I'll start with some definition. So RIM, I think, sets the foundation here very well. When we talk about brain capital, we are talking about the framework that RIM has led to develop that integrates brain health, brain skills, and the enabling environments to foster socioeconomic resilience. And I think it's important to highlight the components there: brain health, brain skills, as well as an enabling environment. For the purposes of this particular talk, I'm looking at predictive modeling as a method of analyzing historical and current data to forecast future trends. So I will talk a bit about what we can see going forward if things remain as they are. I'm focusing in particular primarily on brain health as opposed to brain skills in terms of the Brain Capital Index. And here I will focus on the health and economic burden associated with brain health for this presentation. I think both Rim and Christy highlighted, with Christy doing some work to build that space. But I think in the context of Africa, we have a paucity in terms of the brain skills data set, and that's certainly an avenue that we can all look to help fill as we go forward. So conceptually, in terms of thinking through burden, particularly associated with brain health disorders, we can break the burden into three categories: health-related losses, economic losses, as well as intangible losses. Health-related losses are typically what we think when we think of health. So it's associated primarily with diseases and illnesses. And then for economic loss, we can think of it as two arms, what direct spending, what we are spending when we're ill, in seeking care, and then indirect costs being the less direct ones. So when we're ill, we're not able to work. So we're losing both hours at work as well as income associated with working. And so those are the two main branches related to economic loss when we're assessing that. Intangible loss will capture intangible things like the suffering associated with illness that's still something we experience, but at this stage, it's still hard to measure or quantify. So I'll focus first on the health burden, where we're seeing brain health disorders. A lot of this data is coming from the Global Burden of Disease study. And so globally, we can see that for now, a lot of the brain health disorders centered in Southeast Asia and Asia. I've put Sub-Saharan Africa and North Africa and the Middle East in red just to bring focus to that. They're not major centers for brain health disorders at this point. But we do know that for every one brain health DALI in high-income countries, there's 4 more elsewhere. And here, for those not familiar with the DALI measure, DALI is the disability adjusted life years. And that's a more comprehensive measure of health loss that combined both the loss associated with mortality as well as living with disability or illness. A lot in both presentations that have gone before mine, the subject of Africa's demographic structure and having a youthful population has come up. Yes, for now, Africa is very youthful. The population is young, and there's a lot of vitality there. But looking ahead, that population, there's no mystery here, is going to age, will grow up. And so we see the population structure transforming in the distant future, moving from a primarily young population to one that has quite a significant population in the middle and older ages as well. And so those are all vulnerabilities that, as Rim highlighted, we have to be mindful of as we go forward. Transitioning to economic burden here. So based on work we previously completed at IHME, we are estimating that globally about 1.8 trillion is being spent in direct healthcare spending on brain disorders, and a lot of this is being spent outside Africa, but in Africa, even with that, there's still about 8 billion being spent in 2019. And as a share of total health spending, we're spending less than 5%, but given the level of spending in general in Africa, this can be significant. In terms of indirect costs, this slide is reporting a figure from a recently published paper from our team that focused on estimating the cost associated with informal caregiving. And so in the first panel, we are looking at weekly hours dedicated to caregiving. And we see that as an artifact of the older populations elsewhere, there's a lot of caregiving hours in the other areas that's highlighted in green, but yet still, Africa does have some caregiving hours associated with various brain health disorders on the globe. If we look at the next figure that highlights the lost hours of work associated with that caregiving, we see that indeed a little it has a little bit more of an impact as well. In the bottom two panels, we are looking at the per person lost income as well as the proportion, and I think the last panel D is the most interesting here. It's looking at the proportion of gross domestic product that's lost income associated with caregiving. And here, even as we have noted that in the other three figures, Africa doesn't seem to have the biggest burden. We see some nuance here, right? With parts of Africa losing on the upper end of 1.5% of their gross domestic products, that's their national income, in terms of activities related to people caring for individuals with various brain disorders. So connecting the burden with the spending and looking at this across the African Union regions. Here's a pie chart that's highlighting on your left the health burden characterized in dollars versus total spending related to the various brain health disorders. We see a significant mismatch in the sense that the majority of spending on brain health is happening in North Africa, but as of 2019, the sub-region with the highest burden of related to brain health causes is Western Sub-Saharan Africa, which spending some but not spending nearly as much as the burden would suggest should be spending. So this sort of analysis makes an assumption that on average, spending should sort of match what the burden reflects. Okay, so this is the key figure here, bringing it all together, but looking towards the future. So for the first panel, again, we're looking at the trajectory of burden from 2020 to 2050. And we can see, on consistent upward rise in the burden associated with various brain health disorders. And in the future, we see that a lot of the growth in burden associated with brain health disorders will be driven by mental disorders and neurological disorders. Stroke is significant enough that that's called out. And then in terms of direct spending, we see that increasing over time, which seems this line is making some assumptions related to the population that will be exposed to brain health disorders, as well as the average that will be spent per case treating these disorders. We do see that there's an onward trajectory here as well. But when we bring the two together, and this is just one of the possible scenarios for the future, we see that whereas a burden is projected to increase by 94%, spending will increase or rise only by 67%, which presents a bit of a mismatch, suggesting that there's a gap whilst we are now, I mean, or in the recent years, the spending is a bit more on par given the rate of growth, both in the brain health disorders and in the population. The rate of increase in our spending will lag behind the growth in burden. And so there lies an opportunity there for some strategic investment, pulling it all together and highlighting just the broader lay of the land in terms of overall health spending on the continent. And this figure in particular highlights just sub-Saharan Africa. But the patterns should not be too different when we bring in the North African countries. So essentially, historically, a lot of health funding in Africa comes from governments and out of pocket. And out of pocket, you generally want to dissuade because that pushes households into poverty. And our goal really is to try to get people out of poverty, not to push them into poverty. And so we see that in terms of sources of health spending, government spending will continue to play a prominent role. Out-of-pocket spending remains significant, and that's an area that will be important to proactively manage, as I highlighted, because that presents a risk that's not healthy. And the other thing to note, if you've paid any attention on what's happening in the global health financing space, whereas in the past, while not the largest share of health spending, development assistance has played an important role on the continent, especially in countries in the low-income countries. Going forward, development assistance is expected to contract. And so it's really important to ensure that the spending going forward is government funded and out-of-pocket spending is managed on the population. Wrapping up here, we see that while the burden of brain disorders is not crippling yet in Africa, it's likely to increase going forward. And I think this is something that we need to continue hammering because the future planning seems to not take precedence in a world of many competing priorities. We're seeing that if intentional action is not taken, spending will lack for various reasons. And there's an opportunity here if we act sooner than later in investing in brain positive activities to support the development of the continent. And I think Rim highlighted does very well in some of the areas, specific areas she presented as opportunities in which brain capital investment could focus on to harness the opportunity for economic growth here. Last slide. A lot of the numbers and data I highlighted comes from a work that was funded by Roche at IHME, and there's a Brain Health Atlas website that presents a lot of this data. So thank you. That's all I have.
Wonderful. Thank you, Angela, for that deep dive into the brain health dynamics, the burden and cost and spending dynamics in Africa. It was a good deeper dive from what Rim earlier presented, and obviously illuminates a significant opportunity for investment, shall we say, and the need to do more. And so in that spirit, speaking of investment, I'd like to next invite up Rahul Chandran, who's our investment specialist on this call. Rahul's the Chief Partnerships Officer of Grand Challenges Canada. Rahul, the floor is yours to share some perspectives and experience on investing. Thank you.
Yeah, thank you, Harris. Thanks, everyone. I'm going to be brief because we've had all the evidence, and so I'm not going to add to it. I'm not a scientist. I'm not a brain capital specialist, and I'm not even an African. So what am I doing here? I'm here to talk about how we move money towards problems. And very simply, brain lens investing isn't a new asset class. It's just a way of reading existing assets, right? If you think about what we did with carbon risk to portfolio analysis, it's not that we created a new class of companies doing a new thing. It's we started to understand where the liabilities and where the opportunities were. And you saw, I don't know that I have anything more compelling to say than Angela's slide that there is a $1.3 trillion market opportunity on the table. That is really what it is. So every DFI, every development bank, every impact fund, every multinational corporation that touches Africa, which means that touches the world, right? Because of that population slide that you saw, has brain capital baked into the underlying financial model that they operate on. But they're not using it as a lens, and that is a pricing error and an opportunity. And so, you heard, and I strongly support that the development narrative thinks of Africa's brain health as a burden. And I reject that, right? I think that Africa, as we all know, has the youngest population on Earth, that it's going to be the largest population on Earth in any container that we wrap around. Africa's not a unitary actor. It's a complex patchwork of different languages and countries. But if you're going to put it together, it's at least 1 in 4 people. It's the young people. And in a whatever this AI economy world is that we're all bleeding into, cognitive skills are going to be the thing that is scarce and valuable. And so that demographic doesn't become your problem. It is, in fact, the planet's generational asset, if it's invested in, and it's not being invested in. So it isn't a question, I would say, of how do we do this based on what we have learned from what we have done in the West. I, in fact, would say I would want to desperately avoid the institutional infrastructure that has rendered the brain health lens invisible in the way that capital flows and in the way that we price and talk about risk and understand humans in the West. But we can leverage some of the tools that enable capital to flow: measurement, disclosure, investment architecture. And that is congruent with our experience. Grand Challenges Canada, where I work, has funded 1,700 odd innovations in 100 plus countries. 67% of those are local to the country that they're delivering the impact. The only thing that I know for a fact, or one of the few things I know for a fact, is the people are there providing the solutions if you're willing to look for them, and they're there in the communities and the countries that we speak. The science is there. You've seen all the science today. The evidence is there, and it's hard and it's clear. The lens is there. So why isn't the capital flowing? And I think there's sort of three levels of opportunity that I'll talk about. So there's the sovereign level, the African Brain Capital Index you've heard about. That is a tool for us differentiating between countries, not on a GDP or political risk basis, but what is that? And I'm hesitant about this term, but the cognitive productivity trajectory at a population level, right? Hey, there's a population of young people. Are we investing in their brain health? That starts to be a differentiator. That is an allocation opportunity. It is also a comparative opportunity for governments, right? This is how governments start to talk and change their policies, is when they see themselves being measured and not falling behind an abstract indicator, right? We all have the Sustainable Development Goals. That's great. When the SDGs were being negotiated, I led a team figuring out what changes policy. And the answer to what changes policy in almost every country around the world is when you're compared to somebody you care about and you feel like you're falling behind. That's true. You all know that as a human. You think about it. There are people in your mind that you don't want to fall behind. Countries are the same. They're run by humans. They don't want to fall behind. So the Brain Capital Index is a start. It's not perfect, but it is an opportunity for measurement. And then the question is, are you looking at portfolio countries? Are you conducting due diligence, if you are investing, on how interventions are building or protecting brain capital in a disciplined way? Not as a checkbox, not as yeah, there's a brain capital indication, but hang on, if I'm choosing between A and B, something that delivers brain capital is actually going to have pull return potential as the world ages in the West and the young people become working age in Africa. If you're generating that cognitive function, there's going to be a return on that cognitive function. Again, you've just seen a whole bunch of stats on that. I don't want to go over them, but they're there and they're real. So these are the real returns. This isn't charity. This isn't development. This isn't aid. This is investment. And there is an investment logic. And the last point on measurability, which you sort of, I think you've heard and seen, from the level of the scan for ECD and the way that we're able to track and understand where we're seeing cognitive improvements, that allows you to invest in results-based ways, right? There are outcomes that we can track, there are outcomes that we can measure, and they are doable. So there's a huge amount of opportunity, but we're still not quite there. All right. What really helped for the carbon world, which I used to work in, was scope 1, scope 2, scope 3. How do we measure emissions? How do we tie them in the box? How do we actually then say, oh, this number versus that number? Again, that is how we compare things. And we'll need to build that, and that is being built. But I think what we're seeing is a moment where people who actually invest and build that analytic capability before the market has agreed on a consensus standard, and that consensus standard is emerging through the EU CSDD and other indicators of workforce mental health. If you're willing to invest, that's where you make returns because you're ahead of the curve. So there's a curve. We know the trajectory of the curve. We know the direction of the curve. We have the tools. They are early. They are being deployed. And the question is, how do you push the capital in there where the investments are possible? They're makeable, there is return over time, and the innovators are there on the ground. And that is simply the application of the lens, the integration of it into existing processes. If we try to make this a new thing or a separate thing or a different thing, we miss the opportunity. If we talk about the simple fact that every country spends a fortune on educating its population, right? This is generally education and health are the two largest public sector expenditures. Some countries spend a lot on defense, but we're not talking about those countries today. So most countries that are smart are spending on education and health. And if you're not spending enough on the mental health, what you are doing is undermining every dollar invested in the education, right? It is a downward drag on the return at a societal level and at an individual level on that investment. And if you're not investing in African-specific brain capital outputs. You're not investing in where the global brain will be in 10 years, in 5 years. It's coming fast. This isn't a distant future. And so that opportunity is really clear. And I think we need to just articulate that opportunity, surface those innovations. I see the mental health space, I have some bias perhaps towards it, as a particularly compelling opportunity because it's where you can lift the downward drag or the loss on an existing investment very easily. And there are new leapfrog ways to do so. But you see this in education investments as well, and early childhood development, as Kirsty was talking about, those first 1,000 days, they're not determinative, but wow, is that an opportunity to do something? All right. And so there are clear spaces where we know how to intervene. There are models for intervening. There are companies to invest in. And folks out there, whoever's listening, I urge you to invest and take that opportunity. And I'll stop there. I think we've heard all the evidence. The evidence is great. It's really compelling. I don't know that I have more to add. Thank you.
Terrific. Thank you, Rahul, for bringing in the investment lens, the finance lens, and the development financing lens as well. I would encourage folks that are interested to learn more also about Grand Challenges Canada to check out the website and look at the initiatives that are being led by GCC or developed in partnership with GCC. So you'll see some examples of this type of investing, and we can double click on that in the discussion with Rahul, so he can share some case studies. But thank you, Rahul. It gives us a sort of an actionable framework to take forward, and some hope of things that can be changed based on the preliminary data, of course, that was shared by the earlier speakers. So that's gives us some thoughts about what can be done next. And so that is a good segue to George Vredenberg, our last speaker, who's the chairman of the Davos Alzheimer's Collaborative. George has been thinking for a long time now about what to do in Africa, particularly with the 6x5 plan, but others. George led the G20 side meeting last year in Johannesburg. George, the floor is yours. Please share your thoughts about what DAC is doing, and then your reflections on the prior speakers today.
Well, thank you very much, Harris and Rem, for inviting me to this conversation, which I find always this particular group of people I both work with and I learn from every time I hear them speak. So DAC was formed in 2020 at the World Economic Forum in the belief that Alzheimer's and related brain disorders were then and would be in the future a global health challenge comparable to infectious disease. And knowing what we know from what we dealt with as a world with infectious disease, the global south was always left behind. It got the leftovers after the global north ate up whatever vaccines were developed and distributed. So we were charged with developing links between the global north and the global south, how the global south can teach the global north, as well as the global north innovations can get to the global south. So that's our mission, is to be, like Gavi and CEPI, a global collaborative mechanism across industries and across different players in the system, political, economic, and social, but at the same time, make sure that we're encompassing the globe. For our dementia itself, we know that most of the cases of dementia are in the global south. With that level of introduction, we held a conference in Kenya, in Nairobi, in 2024, to bring some African researchers together to learn what we could learn about what was going on in Africa. But what we did learn was quite different. We learned how much energy and how much expertise was in Africa, but the African researchers themselves did not know about each other. There was not much collaboration. There was not much understanding of what was going on. But what, in fact, happened was there's this enormous energy to try and bring together a research plan and an implementation plan for Africa. And so we produced this, what Harris has referred to as the 6x5 plan. It has 6 priorities, which I will not go through each of the priorities, but what we learned is the obvious to anyone who knows anything about Africa. Africa is not a nation. Africa is 54 different countries. It has perhaps the most political diversity in the world. It has the most biological diversity in the world. It has the most genetic diversity in the world. And so implementing things at the African scale is going to be a tough putt. But what we also learned was that there are some really deep cultural strengths to Africa. Recent surveys globally of the mind health of nations around the world find that the strongest mind health in the world is in sub-Saharan Africa. And why is that? Because there are 3 generations of families living together. There are strong cultural and community ties. And the worst in the world with the United States and Europe, where in fact we're atomistic and the like. So how do we trying to get at the problem of Africa-wide implementation when we have political, genetic, and cultural diversity? First, advocacy. One of the problems in Africa is that mental health and neurodegenerative disorders are treated very much like potential madness, potential, devil worship, a devil takeover. And so, quite frankly, we have to reduce the stigma associated with brain disorders, both mental health and neurodegenerative diseases. So that is a pillar. The second is understanding that this is a life course issue, which is basically both the brain skills and the brain impairments that occur during the course of life start at birth, and indeed start pre-birth with a mother who may be undernourished, who lives in poverty, and otherwise, as a consequence, gives birth to a child that may not have a fully formed or fully developed or fully capable brain. And so, as Kirsty has pointed out, there are ways now to try and get at this issue of how it is at the very earliest stage of life we can discern some disorders that can be treated then that can affect positively brain health course. Wellcome Trust has done work here. Kirsty has obviously done some excellent work on imaging, but Wellcome Leap has done work on gut microbiome disturbances and disabling characteristics, which can be discerned at birth within the first 6 weeks of life. Socialization, play styles have an effect on later life socialization skills. A parent that dictates to the child or a parent that ignores the child, in each case, has created some sort of a socialization disability, so to speak, in later life. But a play that has interaction can, in fact, encourage socialization skills. That insight, born of research in Africa, has now been implemented at a population level in Singapore. So we are beginning to see what we can do at the earliest stages of life. But there's also midlife perceptions. Cardiometabolic disease is itself associated potentially with brain impairment and cognitive skill loss in midlife. But we now have GLP-1s, which may be able to deal with diabetes and obesity, and associated with potential reduction or increase in risk of late life neurological diseases. But we now have GLP-1s, which in fact are off patent, and where we're now talking about how it is that we can conduct widespread use of GLP-1s using Indian or Brazilian manufacturers to get that product out globally, particularly in the global south. So that would potentially reduce the neurological or even midlife brain and cognitive disorders. But then how do you detect mental disorders? So we have to find very low cost implementation. So we have research cohorts in Africa and Latin America and Asia, but research cohorts in Africa that are testing whether or not one can discern either mental health or neurodegenerative decay off of cell phones using voice technologies. Whether we can actually use not just blood as a means of getting at at genetic or biological characteristics of people, but saliva or blood spot technology, so that a community health worker in rural areas can take a blood spot without having to do a venous draw and not having to refrigerate that blood quickly. So low-cost means of detecting midlife and late life disorders and understanding the genetic characteristics of the individuals in different parts of Africa and different characterizations of the populations in Africa. And of course, has been mentioned by a number, cell phone technology, digital technology is now available broadly in Africa, both on the terrestrial internet, but also potentially by satellite delivered internet, where terrestrial internet is not available. So can we use cell phones both to detect disease, but can we also begin to use it in the mental health world to actually treat mental health disorders? There are some entrepreneurs of all places, Sudan and Yemen, who are actually doing call-out services to the entire population using AI techniques and asking a certain set of questions to discern whether there is an imminent mental health break, a moderate risk of mental health break, or a low risk of mental health break, and then having a human call those with the most immediate mental health concerns. We can do the same thing with cognitive disorders during the course of life and in late life by calling out to populations to discern through voice technology whether we have a person that may be beginning to decline. And then how do you deliver treatments? Well, in the mental health field, it may be chatbots and other technologies, which is what Gates Foundation is playing with in parts in 3 countries of Africa. But also, how do you actually deliver potentially medicines? Well, new drone technologies and motorcycle-based skills that are being used to deliver medicines in the infectious disease space can be used potentially for medicines that we can identify and vaccines that hopefully will develop in the next 5 to 10 years at low cost, which can be delivered to populations even in rural areas. So there are low-cost techniques to both detect and potentially treat. But we also know that the risks for mental health and neurodegenerative diseases occur during the course of life. How do you identify individual risk characteristics? Rim's risk for potential cognitive impairment is going to be different from Angela's risk for cognitive impairment based upon their potential characteristics. And so we're working with Worldwide Fingers and now what is a 6 cohort operation to discern whether or not we can identify individualized risk assessments and then individualized risk interventions, largely based upon cell phone technology. So finding these vaccines, these risk reduction strategies that are individualized and individually tailored, and then GLP delivery for cardiometabolic disease in midlife, which will reduce the risk of late life dementia. All of these much more lower cost, tailored to Africa solutions are at least potentially possible. But going back to the comment from Rahul, we have to get investment in some of these. It's not enough just to say that they're potentially available. We have to find ways to invest in them so they can be actually implemented. And then in implementation, we're going to have to deal with 54 countries, each of which may have different data regimes and want to own their own data or the data on their people. And so can we implement things across boundaries in Africa in a way that in fact can serve and scale at an African level as opposed to having to do this in 54 countries. And that is going to be a political challenge. And so dealing with how you deal with the political diversity as well as the genetic, biological, and risk exposure diversity of Africa is a real challenge. So I applaud the conversation here that you brought together, Rim and Harris, but implementation is going to be a challenge. But as the prior speakers have pointed out, the extraordinary benefits of successful interventions at scale in Africa for not only Africa, but quite frankly, for the world.
Brilliant, George. That's tremendous and inspiring overview of all of the different work that DAC is doing and all the work that you project to be doing as well in the near future. Feels very much you're integrating science and health systems and technology and policy and financing all together. And so I think encourage folks to keep tracking DAC and look up the 6x5 plan and study in detail. So that we've concluded our keynote interventions for the webinar today. And as folks listening can see, we've really traversed a great spectrum of the African brain economy, from starting with economics and looking at macro factors and connecting brain capital with productivity and economic growth, looking at science, very deep biological science, looking at health data science, getting back into investing and investment opportunities, impact investments, and then George providing us with a nice integrated perspective there at the end. We perhaps have time for a couple of questions. I might start with a question for all of the speakers, and if there was perhaps one thing for the speakers now, to give us your one thing that you'd like to see in the next year to move forward the African brain economy strategy, what would that one thing be? What would you like to see manifest that you think could make a difference in this sort of integrated economic strategy that we're here to talk about today? And Rim, I'll invite you to go first. And I know all of you have given us a few things you'd like to see already, but based on your synthesis of all of the speakers today, what is the one thing that you think would move things in the next 12 months?
Thank you, Harris. First, I want to thank George for having this great overview, because it's a systemic view on how we can transform Africa into a brain positive trajectory. And this is also what I showed in my slide. But one thing that must be, in fact, a key condition for this transformation and putting Africa into this trajectory for a brain positive economies. As mentioned by George, this is not one country. There are a bunch of countries, and they have different levels of also development and priorities. So one thing is an investment plan at the African level. This is key for brain economy. It's essential. And then at the same time, trying to work with the government to improve the institutional capacity and to anchor brain, I would say, positive thinking into the policies. So this is what I see essential to ensure that this demographic dividend that I talked about will not return or become a curse.
Thank you, Rim. Thank you. I think we have a number of multilateral forums that we can start to develop these plans, policy plans and investment plans. And then, of course, there are not just multilateral forums, but actual events coming up in Africa that I know many of you are targeting. So we need to start to develop these strategies. Yes. Maybe in order of the speakers. Kirsty, would you like to go next?
Yeah, choosing one thing, always a toughie, but I would say that integrating health and educational investment, or integrating the integrating the investment in health and education, and thinking about it as a cycle rather than as a discrete time point, I think will make a massive difference.
Yes. Yes. Terrific. Thank you. Angela?
Yeah, I think one thing that will move the needle quite sizably will be political buy-in at the continental level. So in the global health financing space, now, given recent events in terms of contractions of aid, there's a big focus on domestic resource mobilization. And I think one thing that's helping that gain a lot of momentum is that you have the African Union, Africa CDC, Ghana's president, like championing the cause and making the case of why it's important that African countries invest in their health system. I mean, alongside the case that we are also making, that investment in health is broadly investment in your economy and development, right? And so if there's a way we could get, I don't know, at the AU level or at the Africa CDC level, an ambassador or a champion that's at the table of all of these different conversations and reiterating the importance of the opportunity we have now and the importance of seizing it and, bringing that conversation and point back repeatedly, I think we will get a lot of progress. Then we go on the ground. When you talk to people, the permission has come from up, and so people are more responsive as well. So,
Yes, yes.
Well, I've just second what Rim and Angela and Kirsty have said. I'll give another example that emphasizes the importance of what they've said. We're working now with the Pan American Health Organization, which brought together in Washington at the World Bank meetings 15 ambassadors from Latin America. And together with BMS and a couple of companies, plus some academic scientists and economists. And there was agreement around a dinner table about going forward on a continent basis, recognizing that not every country is going to move at the same speed, not that every country or every business is going to have exactly the same idea. But the goal is by setting up some very precise working groups, 4 working groups that involved multiple sectors, that one could define pilot programs in a country or across countries that basically brought together the public, the private, and the the advocacy sector, shall we say, along with economists and scientists. And so that has then defined a process that we will roll out starting at UNGA with PAHO, and then with a regional meeting, probably in Mexico. But then it's anticipated to be a 5-year plan, which is almost largely process driven, where basically the continent buys in to a process to get at this challenge. I don't know whether that's feasible in Africa. Africa is more complex than Latin America. Latin America is only 35 countries, and the bulk of the biggest ones you can identify. There are dominant countries like Brazil, Mexico, Argentina, maybe Colombia, and a lot of smaller ones in the Caribbean. So I don't know that the geography and the political structures work exactly the same way, but I would agree with Rim. It's in a plan and a political will, and with Angela, sort of a process of identifying multiple players to buy in, and then during the course of the next 2 to 3 years, being at the major continental convenings of political, health, and finance ministers, political leaders, finance, and health leaders as well. And so I just think we've got work to do, but I think it's doable, but to get people bought into a process, to recognize the demographic opportunity as well as the challenge, to recognize what should be done continent-wide and what has to be done at the nation-state level, to recognize in the business community what the opportunities are if there were a buy-in to a process and investment opportunities, that you can begin to get some mobilization of the investment and political will to do what RIM identified as the top: investment plan and political will.
Well, I think that is a good place to end the webinar, that we need a plan. We have examples of how this is coming together in other parts of the world, such as in Latin America. Also recognizing that we had a major European Brain Economy Summit last week in Brussels that RIM was in attendance on, and maybe there are some learnings from there, although it's a very different context. But we need a plan for Africa. It needs to integrate the different elements we've talked about today: science, health, education, policy, investing. And so that is the charge for us. And I think it's a great update webinar for us all now on the African context. And I guess we need to go forward thinking through how to leverage the multilateral forums and how to leverage also continental convenings as well. So we have a goal here. So thank you very much to all of you for your interventions, to the speakers, and for all of those listening for your interest, and follow up with us. Reach out if you'd like to be involved in how we move this forward. So thank you, everyone.
Thank you, Rem. Thank you, Harris, for convening us.
Thank you.
Bye-bye.
Thank you. Thank you.